In the meantime, the press lets hang out there. Hospitals are overwhelmed. Implication,
Right.
overwhelmed with COVID. Then you look at the data, 13% of the beds have COVID. The rest is the consequences of delayed treatment. The rest of it.
Another piece of that, Drew, that the mainstream media doesn't report, they don't give context to the numbers. I see these sensational headlines on a daily basis.
Yep.
ICUs at 88% capacity.
Yep.
Here's what they don't tell people. Hospitals aim to keep their ICUs somewhere between 90 and 92% capacity.
Right. So
that's where they want to be. Hospital censuses, they aim to be at 85 to 80% capacity. So if your ICU is at 88%, the CEO is sitting in his office saying, well, if we don't get some more patients in there, we're going to have to send nurses home and techs home early.
And they may actually have the beds, they just don't have the staff. This is a game that they play all the time, which is they restrict the staffs to the last moment and then open the beds and add the staff when they can no longer wait. But that goes down as a full ICU, even though there's maybe an entire unit open.
Exactly right. And that's something that the lay person doesn't have any reason to know, but it's irresponsible for the media to report these as sensational numbers without giving context to them, which is that we are not maybe there have been a couple of hospitals for the duration of this outbreak that have gotten to capacity or needed to go on bypass. But as you rightly point out, we do this all day, every day in hospitals.
All the time.
There's a person whose job it is to manage census.
That's right.
We do this in real time all the time.
That's right. If I really believe if somebody else had been president, this story would have been second or third story on the nightly news, would have been doctors are struggling, they're setting up tents, hospitals are full, wear your mask, be careful, we're going to get this thing. Anyway, on to China, on to whatever news. You know what I mean? It would not, but instead, we've gone into total crazy mode, which here we are. And the other bottom, in addition for me, the editorial board demanding a lockdown, which is those, I mean, really, they should be sanctioned in some way. I've canceled my New York Times subscription. That's my sanction, because I love the New York Times. I love them, and now I cannot stand to even look at the headline, the heading of the page, because particularly of that moment, but many others since. But the other bottom for me is a medication that I've used for 30 years, that you've never heard the name of before, that you suddenly have an opinion on how doctors should use a medication now, Plaquenil is a medicine I've been using for ankylosing spondylitis, rheumatoid arthritis, lupus, all kinds of things, 4 decades. I've had people on it for decades. We'd tell them, hey man, you could get corneal deposits, and there's a rare retinal thing after 10 years, so see an ophthalmologist every year. I never saw any ophthalmological consequences. In fact, I never saw a single side effect from years of use. I cannot say that of acetaminophen, Tylenol. I cannot say that of aspirin, but I can say that of Plaquenil. And how in the world does Joy Behar, who now is telling a senator that he was going to kill himself because he took Plaquenil, or hydroxychloroquine, as you all know it, that was the other bottom for me. That lay people now having an opinion on how we should practice medicine. And now we're at the point where it's being restricted at the pharmacy because of the hysteria around the drug. You all saw the video of these physicians who by the way, are not just physicians. They were the researchers that blew the lid off of some of the faulty research that was presented in the Lancet. That was an abomination that stopped all the hydrochloroquine research that will, I promise you, show that there's some utility to the drug early, because we all know that. We've all used it. We've all seen its utility. But it's got to be proven legitimately. It's not a drug for late in the disease. We know that. That's been proven too. We got that. No one else should have any opinions about it except the medical community. What do we do about that?
I agree with you. This has been absolutely insane, and I've never seen it before with any other drug in my entire career in medicine. Let's be very clear. Hydroxychloroquine has been FDA approved for an excess of 6 decades. We started using it somewhere in 1948 for the treatment of malaria, and then subsequently for things like you were just mentioning, rheumatoid arthritis and lupus in particular. Has a very, very good safety profile. It's been FDA approved. It's been on the list of essential medications worldwide for 50 years.
And as some of those doctors pointed out, I think they were in front of I don't know what they were in front of the Supreme Court or something, that it's available as chloroquine, which does have some side effects. It's available as chloroquine, not hydroxychloroquine, over the counter worldwide because it's used so routinely for malaria prophylaxis.
Exactly. But the thing that Americans don't seem to understand, and it's because it's been muddied over this issue, is that the FDA does not control how a physician writes a medication.
Not at all.
Once the medication is approved, meaning it's proven to be safe, then I, Dr. Kelly Victory, or you, Dr. Drew Pinsky, can write that medication for anything you want. There are lots of things. We take a medication, Neurontin is a seizure medication, but we use it commonly for chronic pain. Verapamil is a blood pressure medication, but lots of people have tried it for migraine headaches.
Yep.
I could give example after example. The FDA doesn't control that. The only thing the FDA controls is whether or not it is safe, and therefore your body doesn't know whether you're getting it for COVID-19 or for lupus.
Right.
It doesn't
they determine whether a company can bring it to market, essentially, because it's safe and proven. How we use it, they have nothing to say. They cannot tell us anything. They give us a legal frame within which we are more safe in using it, but that's it. And listen, a lot of medicines we use on a daily basis have never had FDA approval. I think isn't thyroxine, I think, if I remember right. Synthroid never had FDA approval.
Right. And so the only
aspirin's never had FDA approval.
The only people who should be involved in the discussion of whether or not I write a prescription for hydroxychloroquine for COVID is me and the patient.
Right.
That's it. I didn't invite the FDA in, the mainstream media, Joy Behar, the pharmacy board, the medical board, or anybody else. I don't care what anyone else's opinion is. That's a decision between a patient and a physician.
Yep, that's right. And so what did you think of that video of the docs in front of the government buildings?
Well, I thought I was supposed to be there in person. That was
okay, fair enough.
Summit. I was supposed to be there, but my own clinical obligations and media obligations precluded me from going. It's a group of people that I meet with regularly on a weekly basis via video. And that's why I am aware of hundreds of physicians around the country who have been using, amongst other things, hydroxychloroquine for the treatment of COVID since probably mid-March. And so I'm aware of the huge body of data that we have collected. So I was happy to see them go. The physician who got the most attention was Dr. Stella Emanuel, who is a family practitioner down in Houston, an extraordinarily passionate woman who has treated upwards of 350 people with hydroxychloroquine, and she's had remarkable results. She's treated some very high-risk people. She's in a high-risk, her population or her patient demographic is high risk, a lot of patients with obesity and diabetes, and she reports no deaths in those people who she's treated early.
I think she said, did she say no hospitalizations too?
We had a couple hospitalizations, but no deaths is my understanding. But what was fascinating to me, Drew, is how much offense people took at that video. It's been taken off of all social media.
It's electronic book burning. We are in the burning of the bonfire of the vanities. The books are being burned. They're just being burned electronically. And this is now an example of that.
Exactly. So she and I spoke, and she was very upset about it. And I understand that. A video that I made a month or so ago was taken down. And the reason that YouTube gave me that mine was taken down, it was an informational video about COVID-19 that was made actually for a church, but it was taken down. And the email that I received from YouTube said that I violated the community standards of YouTube because I made statements, quote unquote, that did not support the position of the World Health Organization. I find that terrifying as an American and as a physician, that they would take it down for that, because the World Health Organization, in my mind, is essentially, an arm of the Chinese Communist Party. But the idea that I can't even put something out there that's informational. Now, I'm the first to admit, Facebook, Twitter, YouTube, Google, those are private companies. They are not, I am not afforded a First Amendment right with those companies, and I know that. So I don't have a legal leg to stand on. They can take down anything they want, but it sure as heck means that Americans need to understand, if they believe that they are being informed by going and searching things on Google, on Facebook, on YouTube, wherever they think they're getting their information, that they are only receiving information that they want you to see. It's highly distilled, highly censored, highly modified information.
Right.
So don't think that you're being informed.